Okay, so you're all well versed with what's going on Zoom. So just allow me to go through the presentation. If you have some questions, urgent questions. Morning, Elena.
Good morning.
We've just going through the process of starting, so not a problem. Yeah, so if you want to have a chat or ask me a question, just wait until I finish whatever I'm doing. Then I'll give you 2 or 3 minutes to talk. Put your hand up. Switch your recording or switch your mic on, have a chat, and then switch your mic off. So whatever environmental noises you may have in your house doesn't disturb what's going on. And off we go. So let me just share my screen and we'll start with the process. I'm quite new with this system, so I just got to find out where the share screen is. I can't find it. I thought I had it before, but it doesn't look like I have it. Just give me a second. Here we go, share screen. Okay. So you've all got Moodle. So this is the Moodle. So I've opened up the what we're going to be doing today. So we've got musculoskeletal ACC guideline treatments, and then we're going to be talking about the shoulder. So the shoulder is opened up also. So here it is down here, right down the bottom. We've got all the musculoskeletal things that we're looking at, and there's the shoulder assessment. So we're going to go through that today. There's a reflection paper that you need to put in. So there's 3 reflections that you need to do during the course of the next couple of weeks, 5 to 10 weeks. And the reflections are quite easy. I'm just going to find that. Have you had a look at the reflection papers? The reflection portfolio? Okay. So the reflection portfolio is it's going to reflect what you understood in the as far as your learning outcomes are concerned, and it allows you to reflect on what's been learned and identify further aspects of your self-study. So it's a great way to try and understand where you're at and what you do and you don't know. So you lodge your reflection papers on the submission portal that's on Moodle. There's 3 of them, and as you lodge them, I'll mark them, and combined, they are a large part of your mark. So you need to make sure you do them. This is the marking rubric, and here is some examples of how you are to respond to the questions proposed in the sheet, the sheet that you'll be looking at to be able to fill out. So you'll be asked to look at what you will asked to learn. There's an example of the statements that you'll be using to express that. You'll be looking at your feelings. What were your feelings at the time you took the activity? And there's some examples there. You'll be asked to evaluate what was the result. If you have been asked to reflect on a specific question from the guest lecturer in this place, write down your reflections regarding that. And here are some example statements again. There's the analysis. What have you learnt, and how is that important for you? There's also some examples there to help you understand what to write, because I know if you're not used to writing reflective papers, it's a bit of a daunting task. So we've given you a template. The template will help you to understand that. The template is in the cover sheet submission. I'm sure it is. That's where it is. So the template is a Word document. So it's easy to work on. And this is what it looks like. So we've got a learning portfolio 1, 2, and 3, all your details. So that's the template. And then we have the learning portfolio. It should be in there. Okay, there it is. This is the reflective learning worksheet. Your course code, learning activity, and student name, of course, and a date.
Sorry, we can't. I can't see your opened files. It's
Can't
still
you see
your
that?
module screen. Oh no,
No,
but other people, I can't.
you can't. Okay, so let me have a look at new share. There we go. Okay, share. So here's the reflective learning worksheet. Can you see it now? Yep, good. So there's the headings. What was the activity? What were your feelings think at the time? What was relevant to learning outcomes? You're going to analyze what you've learned, and you're going to have a conclusion and action. All right. So the action is about um, how does this reflect you in the future? How can you use it in your workplace? And all those things associated with that. Before it was quite a convoluted worksheet. This is really easy. You just got to make sure you answer those 4 or 5 questions, mark the question as one and write down or put the heading as description. So then I can see what you're writing about. Is that okay? Right, we'll go back to share screen. Okay. So then we have the portal. You can see now the portal. So you just open the portal and lodge the 3 papers, and then I'll grade them and post them. Okay, so it's fairly simple. Any questions regarding that? All right.
What are the activities we're reflecting on?
There's 3 papers, there's 3 lodges, there's 3 lodgements, and the activities are what you're learning online. So over the next series of weeks, you'll be asked to, at every 2 or 3 weeks, to lodge a reflective paper on those previous 3 weeks. It used to be, it was broken down very similarly before, but the questions are really hard to answer. And there was question 1 for week 1. It was all very difficult. So this one's far simpler, but you just have to lodge it every 3 weeks. There is I'm sure the dates are being listed on your Moodle as to when you need to lodge them by. There is a final date, but I'd like to be able to see you lodge them every 3 weeks. Otherwise, it just becomes too difficult. Too many things to write about. You know, if you had to write about 10 weeks, you know, it's a book.
So every 3 weeks, we write down what we learned during the 3 weeks.
Use the
and
template.
Could be anything.
Well, it's about what you've learned with me online.
Yeah. Okay.
So, for example, the first 3 weeks we'll be talking about the shoulder, the wrist, the shoulder, the cervical, the thoracic spine, and the lumbar spine. Right, they're the 3 areas we're going to be focusing on, and some ACC guidelines, and that's what you're going to be reflecting on. And then the next one will be the following 3 weeks, and the next one will be the following 3 weeks. All right.
Do you have the words account requirement for that one?
The word count, there's no word count requirement. But of course, being a reflective paper, you know, you need to be able to talk about at a level 6, right? Because you need to be able to outline quite succinctly what is it you're thinking about and what is it you learned. There's no go saying, oh, the assessment was very good. Why was it very good? What did you learn from that? How did you feel about when you learned that? So how did we feel? Oh, I didn't feel very good because of the information I didn't know, or I didn't know enough about musculoskeletal joint names or muscle names, and it was very confusing for me. So you can write it down like that. All right. So it's an indication to you and to me where you're at with your learning. And then we can assess how you're progressing. And then we can assist you in that process. You know, if we see you're not progressing in the way we would like you to progress, well, then we can sort of assist you a bit more. And there are reflective papers to help that. Because there's going to be lots of information thrown at you in the next 10 weeks. And you know, 2 hours is 2 hours, right? So there's not a lot of time to be able to get that information out there. And then you want to be able to ask questions at the same time. So it's only an hour and a half of presentations. All right. Any other things you want to mention, you want to know about? You understand there's the reflective portfolio, activity 1, which I'll open up. There's the reflective portfolio 2 and 3, which I'll open up. So that's where you're going to lodge the reflective portfolios. All right. So when you do your reflective 1, you go to there and you lodge it. When you do 2 and 3, you go in there and lodge it. To give you an idea, the time frame for that is by the 25th of March is when you need to lodge the first reflective portfolio. So there is plenty of time. So I would, after each presentation, start your portfolio, start writing down what you felt about the presentation in those 4 or 5 questions that were proposed to you, and then you can add after each session. Okay. So you're not waiting for the last minute. Does that make sense? It's probably one of the most important part of your learning processes. Sure, the information I'm giving to you, it's important, but the reflective portfolio is probably, and it carries a large percentage of marks. Okay. Anybody else got any queries there? Is that all clear? Then we have the assessments. But I'll show you them later on. I don't think I want to sort of show you them quite now, the assessments, because, well, I could do that. Let's go into the assessments. So we have also in the periods of the next 10 weeks, you have an open book exam. So the open book exam is a physical exam that you'll be doing with me. And at the end, there's 2 days you're going to come back in June. And the date is the 24th of June. The learning outcomes in this particular assessment is to classify musculoskeletal disorders with a TCM and Western medicine perspective, and discuss the major anatomical structures in terms of structures, functions, range of motions, commonly encountered in pathologies and injuries. As you can see, the assessment's worth 30% of your total marks, so it's quite a large percentage. You need to recommend appropriate treatment plans based on physical and clinical assessments, justify the treatment principles and strategies, and demonstrate suitable needling and or related techniques and structural conditions. Report clinical findings, diagnosis, and treatment plans in a recommended format that meets all ethical and legislative requirements. So the open book exam is accessed through your middle classroom, but it will be face-to-face. Hello, Min.
Hello, morning. Sorry, I'm late.
That's okay. Don't apologize. Hello, Jessica. How are you?
Good. I'm just driving in my car from work.
Oh, look at that. Just you're keen. Cool.
So I'm trying to be quiet. Sorry, I'm almost.
That's okay. You can mute your phone too. Oh, yeah, you're supposed you can't. And Min, make sure you mute yourself too, yeah?
Yes.
The instructions. It will open and start it will open and start the exam time and it will close after 3 hours. You are required to be visible on your Zoom class. This is for when it was a Zoom class, but we're going to be face to face. So you're going to be present. There will be access to information that you require to be able to do the exam, because hence it's called an open book exam. I don't know if you've done them before. Has everybody done an open book exam? So it's pretty easy, but you need to know where the information is. So it can be quite daunting, right? If your questions are unclear, please put your hand in chat room. There are 4 case scenarios in this assessment, and each of the marks will be allocated to assist you in your time management. So case 1 will be 12 marks, 25 minutes. Case 2 will be 20 minutes. Case 3 will be 40 minutes. Case 4 will be 15 minutes. You'll be able to consult your notes and reference material. However, we are interested in your understanding application of the course material, therefore consulting others is not permitted. Before you commence this exam, you are required to open an academic honours declaration and to sign below, and that's the declaration. Okay, so that's how the open book exam is going to be structured. And then we have...
Excuse me, Henry.
Yeah.
So exam date is, you said 24th, but actually we go to school at 26th and 27th.
I'll change
for
that
exam week.
Yeah, I'll change that for you. It's not a problem.
Yeah.
Yeah, because I don't have any classes on that week. So Deborah had told me there was going to be Wednesday, Thursday, but I'm quite happy Thursday, Friday. All right. I think that's how it works out, isn't it? So you said you're going to be when?
That's Wednesday.
26th, 27th.
That's
Thursday.
Thursday, Friday, right?
No, Wednesday, Thursday.
Wednesday, Thursday, so that's the wrong date. So it's still Wednesday, Thursday. So I'll just change that date for you, okay? So it still will be Wednesday, 24th. But it will say Wednesday, 26th. I don't know why they did that, but anyway. I'll change that for you. And there's a declaration. You won't be able to see the online exam quite yet. Then we have the practical and the needling exam, which I showed you already. There's the physical examination and there's the practical assessment. You saw those the other day. We'll open them back up again so you can reacquaint yourself with them. I'll just open it, then I'll shift my screen so you can see it. Okay. Okay, so this is the practical assessment, physical examination. Can you all see that? This will cover learning outcomes 1 and 2, classify musculoskeletal disorders with a TCM and Western medicine perspective, and discuss the major anatomical structures in terms of structure, function, range of motion, and commonly encountered pathologies and injuries. 2, assess using clinical reasoning the major joints of the spine in order to determine if the musculoskeletal disorders and pathologies required further referral or collaborative care with other health practitioners. If the assessment is 20% weight of your final mark, the assessment activity is composed of a practical demonstration. The total time for the practical assessment is 30 minutes per person. So you'll be drawing lots to see who goes first, second, third, fourth, whatever. And the time will be monitored. So 30 minutes is what you're going to get. Because otherwise we'll never get through everybody. Perform the appropriate activity as per instructions of your assessor. This is a closed reference activity, so therefore no outside referencing or no consultation. So basically you'll be in the room with me, everybody else will be outside. So you won't be able to ask anybody anyway. You'll be asked to demonstrate 6 tests in different areas. The highest possible mark is 24 marks. To pass this practical assessment, a percentage of the mark, or at least 50%, must be attained. You can appeal to me, and you can appeal to the program leader if you're dissatisfied with my mark. Okay. Here you need to fill the form out, and these are the particular tests of the areas that you'll be asked to perform. Most of these tests we covered, so you just need to go over the presentations that are there on Moodle and just be acquainted with the names and the process of demonstrating that test. And also what is the muscle or what is the structure that each test is looking at testing. Because you'll be asked, why are you doing this test? What is it for? You're going to perform the test. You're going to show me that you know how to address the client and perform the test. Right? There's lots of videos on your Moodle presentations with the Physio Connect, which will show you how they approach a client and how they perform the test if you're unsure. So make sure just at least once, twice you watch those videos and just go over them. You'll be drawing a number out of a hat, and I won't decide which joint you'll be doing because I think that'd be unfair. You're going to choose your own luck and pick a number. Then the test. This is how the marks will be given to you. The position of the client is correct. The therapist is positioned correctly. A will conduct the test correctly, including a clear explanation to the patient. Explanation of the objective test and functions and purpose. When referral might be necessary in body areas where you apply the test. So you're looking at red flags. What is a red flag? So, for example, if somebody comes with lower back pain and the pain is severe and most of the tests that you're performing are positive in the lower back and it's in the coccyx area, it could be a guana cauda, right? It could be an inflammation of the coccyx and the nerves coming out of the coccyx, which is quite dangerous. It's a red flag. So you need to be acquainted with the processes of writing a referral letter that has all your physical examinations written down in a manner that the doctor can understand. And you are to send them to the doctor of their choice. If that's not going to happen, you need to be able to document the fact that you've asked your client to go and see somebody else. So if in the end it is a guana cauda and your client has had a severe case of that and you were neglected in your duty to refer, there could be some complications, and you need to write that down in your referral, in your notes. Okay. So that's important. Red flags. Position the client correctly for the test. The therapist is positioned correctly. Able to conduct the test correctly. Explanation of the objective test and functions. When referral might be necessary in the body that you are applying the test. Okay. And test 3. So it just goes on. Okay. And that's how the marks are given. All right, we'll go back to the main screen. Okay, so we're back on the main screen. And then we looked at the practical assessment. I'm sure I showed you that, but if you want to, I can show you again. Okay, you can see that screen. Practical assessments, learning outcomes 3 and 4. Okay. Compare select biomedical disorders and diseases with the context of medical and TCM, inclusive of etiology, pathophysiology, TCM diagnosis and treatment. So there's a lot there. Recommended appropriate treatment plans based on physical and clinical assessments, justify the treatment principles and strategies, and demonstrate suitable needling and all related techniques on selected conditions. It's 20% of your final mark, and it consists of point location needling techniques. And the total time of the practical assessment is 40 minutes. So again, you'll be picking lots to see who goes first. The only equipment used for the performing point location and kneeling techniques is permitted in this assessment area. Demonstrate the suitable needling and or related techniques on the selected muscular conditions as per instructions of your assessor. This is a closed reference activity and consulting with classmates is prohibitive. Kindly return the questionnaire to your instructor after filling out your student details. You'll be asked to demonstrate in 2 body areas.